I'm going to show you how I perform a PRP injection of the lumbar facet joints using ultrasound guidance. I am Dr. Sebastian, and I'm an instructor for the American Academy of Orthopedic Medicine. Lumbar facet joints are located in the back of the spine, and they usually hurt when patients are standing or bending backwards. We can actually take an ultrasound and put a needle precisely into the facet joints and the surrounding tissue, and this will decrease inflammation and stimulate healing, and this can provide long-term relief from lumbar facet joint pain. First, I'm going to find his L5-S1 and L4-5 facet joints. So I'm going to put my ultrasound right over his sacrum, and you can see the sacral base right here in the middle of the screen. As I move up, that sacral base disappears, and we can actually see the epidural space, and to the side of the epidural space is where I can see the L5-S1 facet joint, and you can actually see the facet joint line right here. So I'm going to make a mark on the skin, and this is going to be one of my entry points. And I'm going to go ahead and inject some PRP into that facet joint. All right, you can see my needle coming in from the left side. It's aiming towards the facet joint, and my needle is on bone. I'm going to go ahead and inject a little bit of PRP. And I'm going to move the needle out and get the top of the capsule as well. Perfect. Now I'm going to go ahead and move up north. I'm going to find the L4-5 facet joint. And here it is in the middle of the screen is my L4-5 facet joint. So what are you going to see? You're going to see my needle coming in from the left. Okay, you can see my needle coming in from the left towards the facet joint. And my needle is in the facet joint right now. And you can see the fluid spreading in that joint. I'm going to also put some on that lamina and on the top of that joint as well. If you want to learn more about lumbar facet injections with PRP, click the link below and visit my website.